Well, hello to all of our Facebook friends out there. Welcome. I'm Dr. Molly Sarowine.
And I'm Dr. Susan Moreland.
We're glad to reach out to you today to do our first Facebook Live event ever. Wanted to have a minute to reach out to everyone to kind of answer some questions and clarify information regarding the coronavirus pandemic. Particularly in light of the upcoming holiday season. We're getting started a little bit late, of course. As you know, Governor Hogan has put some more restrictions into effect as the case rates continue to rise, and unfortunately, our hospitals are becoming more and more crowded. So we're just going to start and give you a little overview of some important topics. Some of you have already posted some great questions. We'll address those as well. And if anyone out there has some additional questions they want answered, please feel free to post them in the comments sections, and we'll be happy to answer them.
Yeah, so I guess we've gotten a lot of questions recently, given the fact that the holidays are coming up, and what's safe to do, and what should we and shouldn't we do. And I know that Governor Hogan was talking about this today. We're seeing a huge rise here in Anne Arundel County. So the CDC has some great guidelines on sort of how to stay safe, because Thanksgiving is this week. We know people are going to be getting together, but how can we do that safely? And really looking at, and the things that they go over, and which we've all been doing, is wearing a mask, washing your hands, and staying socially distant. So if you have people coming in from out of town who you haven't really had in your sort of inner circle, you have to worry about how did they travel, what are the risk factors. So if we're inside, which it looks like in our area, yes, it's going to be slightly warm on Thursday, but it's going to be raining, so it's going to be kind of difficult to do anything outside at this point. We have to look at how can we do this safely, especially if we have people that we don't normally see. So recommendation is keep your masks on inside. If you can have windows, doors, anything open to keep good ventilation, especially if you're in a smaller space, that's really important. Make sure that you are, staying socially distant, doing the, 2 arms length, 6 feet apart if you can. And then one of the things that I was really looking at and thinking about too is, most of the time at Thanksgiving, a lot of times it's a buffet style. So how can you do that safely? So a couple of thoughts are, making sure that either one person is really putting food on people's plates, or having people wear gloves, or washing your hands before and after doing, putting food on your plates, wash your hands again, just to kind of keep people, hopefully, from potentially spreading this virus, obviously.
I think all real important things to consider. It's such a hard time, and we all miss our loved ones and so look forward to this time of year being close with them, but we really need to take all these precautions. And if you can, I think stay with your immediate family and really limit the spread so that we have many other holidays to look forward to going ahead.
Yeah, there's a great website. If you go to the cdc.gov, look at the coronavirus, and they have tips on like daily life as well as what to do for the holidays. It's really easy to look at and kind of get a good idea of what should you and shouldn't you be doing. So, and we'll post those for you.
And Anne Arundel County as well, the health department also has a fantastic website with great resources. If you're not signed up already, you can actually text Join COVID to 30890, and you can get updated text reminders when they have updated information about their clinics, their testing sites, and other health information from the county. So that's another really great resource that we look to for guidance as well.
Yeah, really, and the number, they have a county hotline. It's great. I've called them a number of times, and they've been very helpful. If you call them as well, and Molly's going to talk about testing, the number to call is 410-222-7256. And they'll be able to set you up if you need to get tested and how to go about that.
So let's talk a little bit about testing. Certainly right now the best way to get tested is through one of the state or county testing sites. There are lots of options, again, listed both on the Maryland Health Department website and the Anne Arundel County website. These test sites change on a daily basis. You do not need a provider's order in order to get tested, and you don't necessarily need symptoms to get tested. It depends upon the site and what their protocols are. Some require an appointment, some do not, but there are now, fortunately, lots of options for testing. So just to talk about the different types of tests out there. So the nasal swab test that I think most are familiar with are what's called the PCR test. This test is very accurate. So the likelihood of getting a false negative is pretty low. The important thing to remember about this test is really the timing of when you get the test done. So if you've had a recent exposure, you really need to wait a couple of days. The recommendation is somewhere from 3 to 5, even 7 days from that potential exposure to get tested, because the likelihood of you having a false negative within a day or two of being exposed is much higher. And then you have false confidence that you have tested negative and you really may have contracted the virus and may be asymptomatic and then shedding and potential to spread it to someone else. So unfortunately, if you have a COVID exposure, really you need to strictly self-quarantine during those first few days and then look to get tested a few days later to confirm whether or not you're carrying the virus or not, even if you're asymptomatic. There are now, fortunately, some rapid tests out there that are offered at some of the testing sites and urgent cares, and so it's great that these tests can give you a result, usually within 30 minutes. These tests are a little bit different than the nasal swab PCR tests. They are quite accurate, but they're much better if you are actually symptomatic than if you're asymptomatic. So they're not quite as reliable just as a screening test. So I think these are all important things to think about as people are traveling and want to make sure that they're as safe as possible, both when traveling to see family members and then when returning to see family members. So I think the availability of testings now is widespread, and we're fortunate to have those testings, but definitely keep in mind the timing of when you get tested as to when you may be exposed to family members or when you come home, so that you can feel more confident in that test result. And in the interim, all those strict social distancing guidelines are really the key to contain and reduce the spread of the virus, both to your family members and of course for yourself as well. There are some new test options coming down the road. There are going to be some mail order tests that can be shipped to your home, and so I think in the next, hopefully, few weeks, near future, we'll be able to see the availability of those. Those will be provider order tests, and as soon as those are available, we'll be certainly happy to share those and make those available to our patients. And so it'd be nice to have a test that can be shipped to your home and you can have testing at home. But unfortunately, they're not as available as we would like them to be at this point.
I think one of the questions with that too, when they first came out with it, was will insurance cover it, will it not?
Yeah, that's a good point.
And I think that's one of the things that we're still kind of looking at.
LabCorp had been offering a test that you could order yourself online, and that was actually changed as of last week. So now it requires a provider's prescription. And then, of course, there still is the coverage. If getting tested through the state and local testing sites is covered, it's free of charge, either through your insurance or through the county and through the state.
So in talking about that, one of the other things to think about is, given the timing of this, one of the things we're really worrying about right now is the fact that flu season's getting ready to start as well. So, we really are worried about people who, if you contract the flu and get really get sick with that, then you're going to be much more at risk for this virus as well. So we're really making sure people are getting their flu shot this year. And we do have flu shots here at the office. If you'd like to come in and get it done, all you have to do is call and ask for a nurse's visit, and we'll be able to give it to you here at the office.
So I think, lots of people have asked, well, if I'm quarantining and I'm staying at home and I'm wearing my mask, should I be worried about the flu? I'm not at risk for the flu this year just because I'm taking all of these extra safety measures. But unfortunately, we have seen, even with other viruses, is you can be co-infected with more than one virus at a time. And we have not had high levels of circulating flu and COVID at the same time, which is a very real possibility come the height of our flu season, come end of December, January, and into February. And so co-infection with both flu and COVID could be very, very dangerous. So the best thing you can do is get vaccinated, get protected against the flu. Even if you think you're going to be home at lower risk, you just don't know. We're still seeing high numbers of COVID out there. And so there's a very good chance we're going to see an active flu season as well. So we really, really encourage you to be proactive, get your flu shot as soon as you can, protect yourself, and protect the community, because the more people we vaccinate, the lower likelihood we have for those viruses to be spreading throughout the community. I guess one last thing I'd like to mention as well before we move on to some questions is our current policy is we're trying to keep our office as safe as possible. We want to be able to serve our patients as safe as we can and provide the best care and keep our staff safe as well. So we are conducting as many of our visits as possible as telemedicine visits. So anyone out there who has an upcoming routine appointment, we are going to convert it to a telemedicine visit and cover as much as we possibly can remotely. It's not ideal. It is certainly not the way we would like to be doing things, but it's really the safest thing for both our staff, for our patients, and for the community. We can handle a lot of your issues, even wellness issues, as a virtual visit. We can certainly review all of your current screenings, update what needs to be updated. We can order your screening tests. We can discuss making arrangements for vaccines. And if there is something that absolutely needs a physical exam and in-office visit, with all of these measures in place, we can more safely bring those who need to be seen into the office. Certainly, if you have questions about whether your visit should be a televisit or an office visit, you can give our office a call and we can discuss and determine what's the best action going forward. And even during your televisit, you can discuss in more detail with your provider and come up with what's the safest and best plan for you. So with that, let's move on to a couple questions. We had some questions posted ahead of time, and we're going to address those. One question we had first was that they have seen officials, including our governor, wearing masks and hugging. Is it safe to hug grandchildren when I wear a mask and they don't? And I think, unfortunately, it's just there's a risk involved. There is just no way to have that close contact and it to be zero risk. When you're hugging, you're coming in close contact, and the opportunity to spread respiratory droplets is high. Kids also, as we know, as huggable as they are, they do not always follow the safety hygiene protocols that we have told them 10,000 times. So I think the other concern is that when you hug, it usually tends to be a prolonged interaction. If you can have that hug and then step back, then that might be a little bit safer, but oftentimes that lingers and can put you at higher risk for an exchange. So I think unless both are able to wear a mask, you should probably limit it as much as possible. Some other options are you can have kids hug you more around your legs so that you're not coming face to face. If you are gonna hug, you definitely wanna make sure heads are turned opposite each other. And if possible, both should be wearing a mask, because I think that option for potential virus spread is still there. Certainly other things, kisses on the forehead are certainly reasonable, but really both should be wearing a mask, and particularly for those individuals that have health concerns and at higher risk. As painful as it is to stay apart, you don't want just that brief interaction to be something that causes infection and causes risk. So I think, everyone has to assess their own comfort zone and their own safety profile, but really it's not a no risk interaction, and that if you're going to hug your grandkids, really both should be wearing a mask. You should keep the interaction brief, keep heads pointed in opposite directions, and then afterwards move apart and have everyone wash their hands with soap and water.
Absolutely. So one of the other questions that we had asked was, if you get a positive COVID test, do you need another test after you quarantine? You've heard and read different things about this. So no, you don't need to be retested. Obviously, you've had a positive test, so you have been exposed to the virus. So recommendation is, 10 days of quarantining since you started having symptoms, since they first appear, and then 24 hours with no fever, without using anything like Tylenol or Advil to bring it down, and other symptoms that you may have with this virus are improving, that's when you can start feeling comfortable that number one, you're not going to pass this virus on, and that you should be safe to go out. But you don't need to retest. You've already had the test. We already know that you've been exposed, so you don't have to test to see if you're negative after the fact.
There's a potential too that you may still have some virus in your nasal passages that could be detected with a test, but the studies have shown, epidemiological studies have shown that at that point that is not likely to spread infection after the 10 days and you being symptom free. So the test afterwards is really not required. Another wonderful question we got, of course, is about the potential vaccine. And the question is this vaccine safe? Does it mess with DNA like I've seen on Facebook and other websites? So the new vaccines, the contenders that are in development now, are a new form of a vaccine. They're a DNA-based vaccine. So this is a type of vaccine that has not been administered widely to populations before. It's a very interesting vaccine that's been in development for a number of years. It was actually part of some of the development when we were looking at vaccines for West Nile and SARS and MERS. And so there's been years and years of research going into this type of vaccine as a delivery mechanism, which is one of the reasons why they were able to bring a vaccine to the public so quickly. So it is true that the way that this virus works is using fragments of the viral DNA or RNA in order to elicit an immune response, but it in no way affects your DNA. Human DNA lives within the nucleus of a cell, and that would require the vaccine or the DNA to be incorporated into the nucleus of your cell, and then for those cells to divide and repopulate, and that's just not at all what happens with the vaccine. So it is just absolutely no way going to alter your DNA. All it does, just like any other vaccine, is elicit your own natural immune response to the virus. This is just how vaccines work, is you are exposed to some fragment or part of what was be seen with the virus so that your immune system can prepare the antibodies and develop an immune response that is ready to be able to fight off if you happen to be exposed to that virus in the future. So we need to wait for final data from the phase 3 trials and look to understand fully the safety of this vaccine, but the numbers are looking good. They're looking to be 90 to 95% effective. There seems to be low rates of adverse events, but still all that data is still out there. And there are going to be some unknowns. It's not until vaccines are delivered to millions and millions of people that we're going to fully understand the risks. The FDA does require that no vaccine is approved until they've had at least 60 days of safety data from when the vaccines have been administered, which is the time of most adverse reactions would occur. So we're getting close to that with the current trials out there. We'll have to wait for that final safety data, but it does look very promising that we are going to have some very safe and effective vaccine options in the near future.
And I think one of the things we're seeing with that is everybody's like, well, how are they going to, give it, and who's going to be, how do they stratify that? And that's obviously still in the making. And I think that's one of the things that we'll see, obviously, with doing more of these trials. But the other thing that we're going to also see is the fact that we're not sure how they're going to do it, and with the transition potentially in the government, that's going to be something that we're obviously going to be watching.
All right. Last question we had posted ahead of time.
If a COVID test comes back negative, but you had all the symptoms, is it a good idea to get the antibody testing a month later to double check? And we're saying no. And there's a couple of different reasons for that. Number one, we may see antibodies, but the question is, are those antibodies going to be helpful in preventing the recurrence of this disease process? And what we found is that people who early on did get exposed and had the disease, we know that sometimes the antibodies will fade over time, but sometimes they're still there, but they may not be completely effective in preventing the virus from recurring, unfortunately. So by getting that test, it's not going to say to us, okay, great, you're safe, go out because you've had it and you've got these antibodies. We don't know that. There's not enough data for us to be able to reassure you that that's the case.
And unfortunately, there have been few cases, although not common, of reinfections with COVID, even after you've been exposed and recovered. So kind of time will tell as far as what that long-term immunity is once you've recovered from COVID. But at this point, we can't feel confident with that. And so therefore, even the antibody testing is not reliable.
Yeah. And I think one of the things that was posted, which is we can never say enough of this, and I'm sure you see it everywhere, is wear your mask, wash your hands, and then watch your distance. I mean, the 3 W's are just so important.
Absolutely. All right, so let's take a look. I think we have some other questions that have been posted throughout our discussion. So let's take a minute here and see if we can see what we got. Let's see here. There's a question about the positivity, the breakdown of the positivity rates by zip code. And we've actually gone ahead in the response with a post of those rates. The state of Maryland and the county keeps data that's updated on a daily basis. So if you go to their website, you can get up-to-date information about positivity rates by your specific location.
And that's a great question right now when some of us may be thinking about going somewhere for the holidays and is it safe to travel? And I think one of the things that unfortunately we don't know is, will the numbers keep continuing to rise, which is of course what we're trying to, prevent, but maybe that's still going to happen, obviously. And so even though data today says this is where we're at, we're seeing things rising, every day.
All right, let's see. Great question here. How long should your grandkids quarantine before coming over for Christmas? So really the guidelines are pretty standard of a 14-day quarantine. So the reason that there's a difference, I know you hear 10 days and 14 days, is that we're talking about a potential exposure and a potential incubation time. So particularly with kids, you don't know when they may be exposed, and they very likely may be asymptomatic. You really need to have a strict 14-day period to ensure that if they were exposed and became infectious and recovered, that whole process would take about 14 days. So to be extraordinarily safe, you would need a 14-day strict quarantine at home with no potential exposures to feel safe that they are clear of the virus.
Yeah, and unfortunately, that's not going to help for Thanksgiving, but that's great to look at as we are thinking about, the holidays coming up next month as well.
And an important thing to think about that, and one of the reasons this is such a prolonged time period, is that even if someone is to become symptomatic, they are shedding the virus at some of the highest rates the 2 days prior to the symptom onset. And so very easily that could be when you're having your interaction. So that extended period, particularly for asymptomatic people with any potential exposure, is really important. Let's see. We have wellness visits coming up, which should be telemedicine. Will you get a link? How will blood work be done? Yep, so we have our telemedicine system has been going strong. Always glitches in the process, and we're kind of working to refine it. But yes, appointments will be switched to telemedicine. You should get pre-registration notifications starting 5 days ahead of time to complete any health updates and forms that may be required, and then you will get a secure link to connect to your visit just 15 minutes before the appointment time. This is a security feature so that to protect everyone's privacy, but the link comes to your email and to text via the phone numbers that you have in our system 15 minutes prior to the appointment. You can then discuss with your provider about ordering any testing. We can order all of the testing labs electronically. and those orders can go to the LabCorp or Quest or any other local lab center. And if you need to order any imaging tests as well, those could be arranged. And so all of that can be discussed with your provider, and you can come up with the best plan for you as to the timing of when all of this testing may need to be done. Let's see, what else do we got here?
And somebody wants us to make sure we post a transcript of this session. I know we're planning to make the video available, so I'm hoping whatever video issues you were having, maybe we'll be able to be resolved if we post this for you as well.
Yep, so it'll be saved and posted and available through our Facebook page.
Absolutely.
Let's see what else we have.
When the preventative vaccines do become available, will they still be in 2 doses? And that's a great question. It depends on which ones we get, but the most likely ones, the Pfizer and the Moderna, are both, 2 vaccines. So, and I know that on Friday, Pfizer sort of put into the FDA for the emergency use, but their complications is obviously trying to keep those vaccines cold enough for travel. So they picked 4 states that they're going to be sending them to kind of work out the glitches to see, because obviously in a very urban environment, it's very different than if you have people who are living sort of farther out in the country, and will we be able to get it to these places safely? So all of that is being looked at this point.
Yeah, there'll be lots of logistics that we'll be looking to our state and federal governments to help, and health departments to help determine how these vaccines are going to be distributed. Will they be distributed at community health centers? Will they be available at providers' offices to be able to vaccinate? So we just don't know. Not to mention, based on the numbers that are available, which populations will be eligible for the vaccine. So all of that does remain to be seen. And an important thing to remember is that it's wonderful that we're getting a safe vaccine out quickly, but we are still going to need to do all of this distancing and infection control procedures for some time. Even once the vaccine's out, it's going to take some time to vaccinate everyone, to have that immunity throughout the population. So this social distancing, hand washing, face masks, it's going to be around for a bit while, just as to keep everyone safe until we can really get a good percentage of the population vaccinated.
It's interesting. I saw Dr. Fauci about 2 weeks ago, and he was saying he feels like even with these vaccines that we're looking at probably this time next year, maybe finally getting back to a more normal lifestyle at that point. So, it is going to take us a long while, because of course trying to get this out to the public is going to be, a bit of a challenge.
Let's see, what else do we have?
Do you have a good, simple definition of antibodies?
Oh, simple definitions.
Yeah. That's a tough one. So antibodies, when your body recognizes something foreign, it starts producing things to fight against it. And that's essentially what antibodies are, is our body saying, okay, this is not something normally that we see. So we're going to produce these things to try to get rid of it, and then hopefully in the long run prevent us from having that same process happen again, because the body will remember. So we've got these immediate antibodies that are produced to fight it off, and then we have other antibodies that are long-term ones. And this is where, with this particular disease process, we don't know if the body is able to manufacture and keep those long-term antibodies. We know that it's pretty good at effectively doing it in the minute, as when you're exposed, and for a short time after, but it's that long-term immunity that we're still sort of, because we haven't had it around that long. We don't know the answer to that, but I hope that helps you to kind of get a better idea of that.
Yeah, I think that's a great explanation. And you can kind of think of antibodies as kind of a surveillance system. So once you have these antibodies in your bloodstream that either occur because you've recovered naturally from the infection or they've been induced in response to a vaccine, these antibodies then are circulating in your bloodstream and remaining vigilant. So if you then come in contact with that same foreign virus, whatever it happens to be, your immune system is ready to go. It can mount a response and hopefully fight off that virus quickly rather than allowing you to get sick from whatever that is.
So one of the other good questions is, will the vaccine be an annual vaccine like the flu shot or a one-time vaccine? So what we know right now is that some of them are a 2-shot vaccine, and it's a good question. Are we going to have to do this every year like the flu shot? And I don't think we know that.
We don't know. So the question is then, once you have these antibodies, how long do they last? So this is the question about even, can you get sick again from COVID? So you've had COVID, you've recovered, your body has created these antibodies. Well, how long do those antibodies stay in your system to be able to protect you, to stay as kind of the first line to recognize if you come in contact with it again? It's the same thing with the vaccine. How long, once these antibodies are induced, how long will they stay? So we don't know yet. It's going to take just more time and more of the vaccine trials to understand, is this something that we're going to need a booster down the road in a year, in a couple of years? Will it have to change? We just unfortunately don't have the answer to that yet.
Let's see. If you start feeling ill with symptoms, besides getting tests, what is recommended at-home treatment, and at what point do we need to seek medical attention? Great question. So I think what we have to look at with this is, when you start having symptoms, you need to go into what we call lockdown mode. So if you feel like you're running a fever, you start having a cough, shortness of breath, that loss of taste and smell, these are all symptoms, sore throat, then you want to get the test. But if it's positive, then you're going to be in quarantine, like we talked about, and obviously the things that I've been really recommending is almost move to a different part of the house. You're going to use a bathroom just by yourself, not that anybody else is using. You want to minimize any possible risk to anybody else that lives with you, because obviously you don't want to spread this. So how do you know if you're sick enough that you need to go in? Well, that's a great question. But if you're starting to have a fever that's not responding to something like Tylenol, if you're having increasing shortness of breath and difficulty breathing, those are absolute signs that, maybe your body is not able to completely fight against it.
Yeah, absolutely. And so really it's when there's sort of severe respiratory symptoms, and at that point really it's time to go to the hospital to have respiratory support and potentially additional care. But at home you can certainly support yourself with rest, fluids, you can Tylenol, Advil to manage your symptoms, and look out for those worsening respiratory symptoms. And when that occurs, take